Scientists are keeping a very close eye on a new version of the COVID-19 Omicron variant. The new variant is being referred to by researchers as BA.2 and is a descendant of the Omicron mutation. This is all according to a report from a UK health agency. At least 3 cases have been reported here in the U.S. so far, and this has been a top story on the Channel 3 app all day. Here to break down what we know about it and what we need to know, Dr. David Banach, head of infection prevention at UConn Health. Dr. Banach, so good to see you as always.
Thanks again for having me on.
So this is being referred to as stealth Omicron. That sounds a little bit frightening. Why is it being called that?
Sure. So this BA.2 is actually a subvariant of the Omicron lineage. So it is still Omicron, but has a few different changes that make it sort of part of that same lineage. So I think the reason that it's been characterized as a stealth variant per se is that it has this subtle difference that makes it difficult to distinguish from other pre-Omicron variants. So the PCR tests do detect this variant. That isn't an issue. But when it comes to some specific characteristics that we used that distinguished Omicron from other previous variants like Alpha and Delta, we can't really detect that particular aspect of this what we call subvariant.
Well, we know with the Omicron variant, it was highly transmissible and thankfully not as deadly as other variants. How does this stealth Omicron compare?
So, I think at this point, there isn't any data to suggest that this particular subvariant is more dangerous, more infectious than the previous Omicron lineage. In fact, it's very similar in a lot of ways. So, I think it's something that, we're keeping a close eye on in the scientific community, really looking as we identify more of this subvariant to see if there's any differences in what we're seeing in terms of patient infectiousness and contagiousness, as well as severity of illness. So it's something to keep an eye on, but nothing that's been identified so far to show that it's any different than the Omicron lineage that we've seen so far.
Well, that is obviously good to hear. Did we hear anything or know anything about the effectiveness of the vaccines against this particular variant or mutation, I should say, of Omicron? I know that the vaccine wasn't working particularly well in terms of Omicron.
So yeah, in terms of vaccine effectiveness and looking at other therapeutics, and nothing to show that this is different than the previously identified Omicron lineage, but again, something that we still have to look at closer. This subvariant is newly identified, so it's hard to make any definitive conclusions, but something that we'll have to keep an eye on moving forward and understanding what it means in terms of the big picture.
Well, appreciate what you know so far, Dr. David Banach with UConn Health. Thank you so much as always.
All right, thanks again.